Good afternoon. Welcome to the UCSF Department of Medicine Grand Rounds. To our attendees from the Department of Medicine, our many friends at UCSF, and as well as the many guests who will join us today either live or later after this is posted on YouTube. I'm Bob Wachter. If everybody could go on mute, please. I'm Bob Wachter, Chair of the UCSF Department of Medicine. To our viewers, you'll note the slide on in front of you has some of the ground rules. Just to quickly go through them, your sound is automatically muted. Only the speakers will be able to speak. We've already got several hundred people on the Zoom. Put your Zoom into full screen mode. Adjust your presentation to fit to window for the best view. For question and answer, use the Q&A button at the bottom and type your question in. We'll be monitoring them, and we should have some time for the end to review some of the questions. The session will be recorded and distributed widely. Just FYI, last week's grand rounds, where we covered some of the clinical and epidemiologic issues in COVID, received more than 35,000 views, a little bit more than our usual grand rounds. As a reminder, next Thursday, we'll do a reprise of that session where we'll do an update on some of the clinical epidemiologic treatment issues, as well as the UCSF response. And just to point out that none of the speakers you'll hear from today in either session has any conflicts of interest as they relate to this topic. We continue to be transformed by the COVID-19 epidemic. Thankfully, at UCSF and in San Francisco, we've seen a slow build of cases, but nothing like the overwhelming and tragic surge that they're seeing in New York and that they've previously seen in China and in several parts of Europe. Here at UCSF, we can feel and do feel good about our preparations and maybe even a little bit hopeful, but it's crucial that we don't let our guards down. We're most definitely not out of the woods. Moreover, even if this pandemic came under control in the next couple of months, it will already have taken a massive toll on hundreds of thousands of patients, on all of our providers and our systems, and on our economy. As I said, we'll continue to use this Grand Rounds every Thursday to cover COVID-related topics. At UCSF and UCSF Health, we have three missions: clinical care, education, and research. All of them have been massively impacted by COVID. We've been appropriately focusing to a large degree on the clinical and public health manifestations and strategies. In the next 2.5 hours, though, we'll focus on our two other central missions, education and research. In the first hour, in a session co-sponsored by the Department and the Office of Medical Education, we'll have a discussion with several of our educational leaders, as well as 4 of our trainees: a medical student in her preclinical years, a student in the clinical phase of training, one of our chief medical residents, and a fellow in gastroenterology. Our trainees have had their training disrupted by the COVID epidemic, but they're also learning some new things about how organizations respond to crises, about leadership, about communication, about telemedicine and virtual care, and about resiliency. Having been at UCSF when the AIDS epidemic struck in the early 1980s, I know that without minimizing the challenges and the costs and the disruption, these and other lessons will influence our trainees' careers. We should also note the extraordinary generosity and volunteerism of our trainees, and a particular shout out to the students. Last week, the students organized a PPE drive that brought in nearly 20,000 masks, and this week they're organizing a blood donation effort. After the first hour, as I said, focusing on the educational efforts here at UCSF from 1 to 2:30 if you're watching us live, we'll switch to another session, this one focused on our research mission, and particularly research that's happening at UCSF that addresses various aspects of COVID-19. This session is co-sponsored by the Office of Research and will be hosted by my colleagues Lindsay Criswell and David Earle. We hope you'll stay for both sessions. I think they'll both be fascinating and important. And as I said, if you can't, they will be posted later on YouTube. So with that, let's start with the first session, which will begin with brief presentations by 3 of our educational leaders at UCSF, followed by remarks and a panel discussion with our trainees. Speakers will be Catherine Lucey, who's Professor of Medicine, Vice Dean for Education, and Executive Vice Dean for the School of Medicine. Rebecca Berman, who's Associate Professor of Medicine and the Program Director for our Internal Medicine Residency. Pat Cornett, who's Professor of Medicine, Associate Chair for Education for the Department of Medicine. Colin Feuille is a Clinical Fellow in Gastroenterology Katie Sullivan is a chief resident at UCSF based at Zuckerberg San Francisco General Hospital. Abdikarin Abdullahi is a third-year medical student in the clinical phase of his medical student training, and Hope Schwartz is a first-year medical student at UCSF. So let me turn it over to Catherine Lucey, who will offer her perspective as a national leader in medical education and the person who's charged with overseeing all of our educational programs. Yeah, Catherine, go ahead and take it away.
Thank you, Bob. Thanks for arranging this. We are very excited about being able to participate and share the work that's being done and to answer questions that we're getting from across our communities into the national venue. We all know UCSF School of Medicine as a tremendously great public institution, and with that comes a responsibility and obligation to society to make sure that we are preparing the type of physician workforce that our state and our nation needs. And I can say very safely that today's pandemic shows us that what is needed is the type of physicians that UCSF has turned up for a long time. People who can provide outstanding clinical care, people who can actually advance discovery to identify new cures, those who redesign health systems, and those who educate the next generation of physicians. In the midst of a pandemic as substantial as COVID, it's very tempting to let education fall by the wayside as a non-essential activity. And we've seen certainly many institutions of higher education just close for the summer. But health professions education, and particularly medical education, has to continue. Because if it doesn't, we lose the ability to turn out a competent cohort of physicians each year and sustain the physician pipeline. This is particularly important now because in addition to the expected loss of physicians due to retirement, career changes, advancing through the educational program, this pandemic may in fact lead to temporary or even tragically permanent loss of physicians who themselves are afflicted with the COVID virus. Our response to this pandemic and its challenges to education have been guided by 4 principles. The first, do everything possible to ensure that all learners are advancing towards a timely graduation. We do not want to lose a class or delay a class graduating. Secondly, ensure that everyone who graduates masters the competencies they need to excel at the next stage of their education or career, whether they're a student or a resident. We do not want to lower our standards. Third, keep learners as safe as possible, but also help them wrestle with the obligation that the medical profession has to care for people who are sick, even those with contagious disease, and understand how to minimize that risk using infection control strategies. And fourth, work hard to streamline the educational responsibilities facing faculty who have other demands on their time during their roles in this pandemic. Adhering to these principles has required us to design new approaches to both classroom and clinical learning to address the pandemic challenges. The first challenge is the need to socially isolate and socially distance, very challenging in a space-constrained campus such as UCSF. And therefore, we had to move all of our classroom and lab-based activities to remote. Secondly, the shortage of what we are referring to as the 3 Ps, patients due to canceled surgeries and delayed appointments, shortages in PPE, and shortages in physician educators who have other compelling responsibilities at that time. And the third issue is that we have a number of learners who have health conditions or who are caregivers for people with health conditions that would increase their risk of serious complications in the event that they did contract COVID-19. And thus, for each experience, we've had to design a second experience for those who cannot be in the clinical environment at this time. So let me talk first about where we stand today. Then I'm going to talk about the national questions we're working with colleagues across the country on and answer some questions that have been in the news in the last couple of days. Where we stand today, advanced clinical clerkship and sub-internship learners have been declared as essential by the school and by our core affiliates, which enables them to leave their homes under shelter in place and appear in the hospital for required opportunities to continue their clinical learning. Secondly, all available clinical rotations that have sufficient PPE, patients, and physician faculty are prioritized first for students about to graduate who need those required activities. Secondly, students who are beginning their senior year so that they can prepare for the National Residency Matching Program and settle on their career goals. And then third, for core clerkship students. So what we have done, because our core clerkship students have fallen into that third category, is we are in the process of redesigning the clerkships into 2 components. The first component is a mastery learning clerkship that can actually be done remotely. Students will study using didactics, small group learning, and then take and pass their shelf exams between now and the beginning of July. And we are hoping that in July, we will be able to resume our typical workplace learning clerkship experiences. And as I mentioned, all students who have compelling reasons to not be in the clinical environment will have alternative strategies. National issues we're working on as a consequence of the COVID. As we mentioned, some senior students may have difficulty getting their sub-internships in before the typical launch of the National Residency Match System season. And what we are asking is to evaluate the possibility of pushing that match back 1 or 2 months to help most systems recover from this challenge. Secondly, we are talking about suspending all travel/audition rotations for the entire season. We've already suspended them through May, and we need to get all schools to decide to do that so students aren't traveling unnecessarily, and students who can't travel because of a local quarantine wouldn't be disadvantaged. Third, we're thinking about whether now's the opportunity to cap residency applications so that we minimize the burden on residency programs as they attempt to sort out who should come for an interview with less data, perhaps. And lastly, I think we should all be prepared to consider the possibility that all residency interviews this year will be conducted virtually because of travel issues related to COVID. 2 questions that have come up this week in the media I wanted to answer before we get into the Q&A session. What about early graduation? Early graduation is used in New York at NYU. Students are graduating early and starting an internship for a couple of months before their designated match program. This is technically feasible here. It is not necessarily advisable unless the student has a residency program to go into immediately. Graduating without a residency program has implications for financial aid, health insurance, and housing. But if we face the situation New York is, we certainly will figure out a way to deal with those issues. And the second question is, are we planning to enroll a new class in August? And the answer is hell yes. We will start a new class even if we need to do so from a remote perspective so that we can continue to turn out the types of physicians our state needs. With that, I'll turn it back to Bob.
Thank you, Catherine. I love the hell yes.
Hell yes.
We'll come back to you for questions a little bit later. Let's turn next to Pat Cornett, who is our Associate Chair for Education in the Department of Medicine, who will talk about learning environment issues in the Department of Medicine. So Pat, take yourself off mute and it's yours.
Thank you, Bob. Thanks for allowing us to focus on the department's educational mission and how the COVID-19 pandemic is affecting us. Certainly, these are extraordinary times and unprecedented in this country's world of undergraduate and graduate medical education, both in terms of the scope of the effect across our country, how it's affecting our range of learners, as well as the likely time course of this crisis. I think it's important to take a moment and reflect on the past. Natural for me with 2 daughters in PhD history programs. I think it's instructive to reflect on lessons learned from program directors who have written about their experiences dealing with crises that have happened to their programs. And I turn to the program directors who experienced hurricanes Katrina, Sandy, Harvey, which I think we can look at and apply some of the things they learned from those experiences. So I've taken 5 points away from reviewing what they've written. Number 1 is we need to have communication, communication, communication. We need to keep our learners informed in a centralized way with what's going on. Likewise, any level of education leader, we must have open lines of communication with those under us. Number 2, we need to ensure the safety of our learners. That's paramount. Our learners need to have confidence that we have their backs. Number 3, we need to continue education, but recognize it's challenging. We must be adaptive and we must figure out different ways that we can provide the necessary education. Fourthly, we have to pay attention to stress and fatigue that will invariably happen with our learners, much less our faculty. And then lastly, professionalism, collegiality, and humanism will be tested, but there's an unsurpassed opportunity for truly lifelong lessons to be instilled in our trainees. It's incumbent upon us as the educational leaders and faculty to model these attributes and recognize and reinforce these qualities in our learners. Before I turn things over to Rebecca, who's done amazing work in the past 2 weeks, I wanted to give everybody an overview of our department's educational programs. We have over 800 faculty actively teaching our learners. We are a major provider of education in the School of Medicine, specifically our clerkship and over 40 fourth-year electives for our fourth-year students. And these have been all heavily impacted by COVID-19. We have 2 residency programs, our internal medicine program, and a special recognition to the residency program we don't talk about much, but ACMED. We've certainly learned how valuable their expertise is in this crisis. We have 17 ACGME fellowships and over 20 non-ACGME programs. In total, over 400 learners in the department, or graduate medical education learners. We have most of our learners here in San Francisco at our 3 major hospitals, but we also have learners who have been all over the world and had to think about their needs and what to do with them, including several residents overseas, as well as our HEAL Global Health Fellowship Program. So with that briefest of overview, I would turn it back to Bob and can learn more from Rebecca about how she's been managing the residency program.
Thank you, Pat. I think our occupational medicine people were on mute, but I know that they were applauding and hooting for the shout out, and I completely agree with you. I think we've learned about the importance of occupational medicine, about the supply chain people. There are a lot of unsung heroes in this place that have become more sung in the last week. Turning now to Rebecca Berman. So Rebecca, if you can turn yourself on there. Rebecca is the residency director for our internal medicine residency, which is the largest of our residencies at UCSF, and as it happens, one of the largest in the country. And I recruited Rebecca here from Boston a couple of years ago, and I don't think I warned her about this, but she has been magnificent in the role, and she's going to share some of the experiences and some of the things she's done in trying to get the residency through this.
Thanks so much, Bob. I feel incredibly fortunate to work with such amazing colleagues here at UCSF. Our residents are just incredible, compassionate physicians who work at the front lines every day, COVID or not COVID times, to take care of patients in a meaningful and compassionate way. Our faculty has banded together to help support our residents as they try to face this pandemic, both by supporting the residents and by providing frontline care to COVID patients. And finally, we have an incredible leadership team and staff who typically meet once a week or once a month to make changes over time, who instead are meeting every single day so that we can now make big structural changes to try to meet a potential surge need here in the hospital. And they're meeting every single day to try to do those changes in a matter of days rather than a matter of years. It's interesting hearing Pat's lessons learned from the literature, because I feel like I've learned those same lessons by the trial by fire mechanism of the last few weeks. Working with colleagues across the nation to try to figure out how to help residents in this time of need. When the COVID pandemic broke out in Seattle, Ken Steinberg, who's the program director at the University of Washington, reached out to all the internal medicine residency program directors and said, communication is key. While the residents are getting tons and tons of emails from the health system, they really need to hear from the program director every day, both to kind of summarize all the information they need and to help provide moral support and inspiration. So we've been doing nightly emails with the residents. We've also started virtual town halls, which have been an amazing way to get our residents who are spread over 3 hospitals and 7 clinic sites to be able to think together and ask questions about how to help move care forward at this time. The second thing Pat mentioned was ensuring safety of our trainees. There's been lots of discussion about PPE, personal protective equipment, and we've certainly been doing everything we can to make sure that our residents are properly trained in how to keep themselves physically safe. But there's growing discussion about the moral hazard of taking care of patients who are not allowed visitors in the hospital or those who are in true isolation due to COVID. I have been so touched by how our trainees have been trying to handle this. Many have reached out to me, and Smitha Ganeshan, who's one of our star interns, has helped coordinate a group of them along with their friends in tech to donate iPads to the hospitals so that patients who don't have access can have technology-assisted connections with their family and friends while they're in the hospital. Pat also mentioned the importance of continuing education, even if we need to be flexible and adaptable. So in pre-COVID times, we had multiple morning reports and noon conferences at all of our sites happening every day to try to teach our residents. And in just a week, we've translated those into online format and now have a single learning platform across our residency. Our trainees will be talking about that more, but I've been so impressed with the adaptability of our residents and our faculty. Pat then talked about the stress and fatigue and how important it is not to forget about physician burnout. So prior to COVID, one of the burning platforms in graduate medical education has been thinking about how do we have residents take great care of patients and make sure that they have time to rest and recuperate? How do we avoid burnout? And thinking about how to deploy a surge here in the hospital, it's been interesting talking to colleagues across the nation and learning that some of the things we might think about, like should we go to skeleton crews where smaller teams take care of patients so we can have more teams, it turns out just leads to burnout. And so I think even more using our 80-hour work week and making sure that we give people true time off to rest and recuperate is going to be important for what looks like it may be a marathon rather than a sprint. I've been really grateful to our colleagues across the departments here at UCSF who have been working to think through how we could help staff the ER, the medicine wards, and the ICUs using residents and faculty from across the institution if necessary. And then finally, Pat talked about professionalism, humility, collegiality, and humanism that come out in times of need. And I have been overwhelmed by the generosity of our residents. We have an online suggestion box where residents can write in to ask questions about the residency. And so many of them have said things like, can you tell us more about what the city of San Francisco is doing for the homeless population? Or I'm worried about my patients with substance use disorders who need needle exchanges. I heard that they're closed. What can UCSF do about that? And that kind of advocacy and compassion for our patients is something that I'm very proud of our residents for, even in this time of need. I look forward to hearing from our trainees what their perspective is on this new changing educational climate. Thank you.
Thank you. Thank you, Rebecca. I also wanted to point out something you put together, which I thought was extraordinary. On match day, there normally would have been this big celebration of all the folks that matched to come here next year, and it became an online virtual toast with, it seemed like 100 or 150 people, including some of our folks and our new members of the UCSF family around the country. It was incredibly heartwarming. So thank you. That's
definitely one tradition I hope we continue well after we beat coronavirus.
Exactly. All right, let's switch it. Thanks to the three of you. We'll bring you back potentially for questions a little bit later. Let's switch to our trainees. So as I mentioned, Colin Feuille is a clinical fellow in GI. Katie Sullivan is our chief resident at Zuckerberg San Francisco General. Abdikarin Abdullahi is a third-year medical student. Hope Schwartz is a first-year medical student. It looks like all of you are there. And I guess keep yourself on mute until you're individually speaking. So we'll talk for about 25 or so minutes. And let's throw out the first question, start with Katie, and just what have you, what's been the experience over the past 2 or 3 weeks? How has this changed your life as a trainee, and you're in an interesting position as chief resident, that you're both trainee and also leader and educator.
Yeah, thank you, Bob. I think that certainly we're seeing changes across the board in both the clinical on the groundwork and in the non-clinical environments that have both been affected over the last couple of weeks. And I'll start talking about the things I've seen on the clinical side. So we've already seen it.
There we go. You lost you for a second.
Can you hear me? So certainly.
Katie, in a second. There we go. All right, we're gonna stick with you for another second, but if you freeze again, we may go to somebody else, and I'll come back in a little bit.
Okay, so I think that on the clinical side, we've seen a surge of need for medicine residents due to COVID, although it certainly has not been as significant as other parts of the country. And I think it's been impressive to see how the faculty have been doing the majority of the direct COVID-facing patient care. This is already changing, and we now have our residents taking care of patients with COVID in the ICU and persons who are getting tested for COVID on the wards. And we're really learning a lot from what the faculty have experienced and trying to help mentally prepare our residents as they step into that role. As Rebecca was discussing, we're also building in this tiered response system to help shift the roles of our residents into sort of the most essential areas where they have skills that will be of most use during this time. And I think that, I'll just acknowledge that the residents are feeling a sense of uncertainty about where and when they might be needed clinically in the system, and are hearing about the emotional toll of caring for patients who do have COVID. But I know our residents are incredibly resilient, incredibly motivated, and dedicated to providing patient care. And I know at a leadership level, we're going to be looking out for them as much as possible. I think on the non-clinical side, we have been trying to maintain our educational content despite the necessity of physical distancing. And we're doing so both out of a desire to maintain normalcy and also because of it's really the educational mission. I think that those who have trained with us know that our educational conferences that occur daily are a really highlight of our culture, of our residency program. And during the first week of physical distancing, when we didn't have those in-person conferences, we built a case series of interactive do on your own time cases based on the New York Times Think Like a Doctor column to provide some educational content while we came up with a live virtual learning plan. And then this week, we're having regularly scheduled Zoom conferences for morning reports and at noon. And our residents have really been instrumental in creating content and showing us the way with experimenting with new learning formats. For instance, we had a rapid fire clinical case series with interesting images and a panel interview with frontline COVID providers. So the creativity has been really inspiring. And I think the community of having everyone across sites all together at the same time has really been helping me personally cope with what's going on and feel connected to our whole environment.
Great. Thank you so much, Katie. And it turns out you've been stalling a little bit on my screen, but I'm told that it looked fine out there, more important.
Okay.
Let's turn to Colin. And sometimes the fellows get lost in the mix. They're sort of less central to the department. They're not taken care of by the school. So how did it feel to be a fellow in terms of how does it change your experience, and what kind of support do you feel like you and your colleagues are getting? Go ahead and take yourself off mute.
Yeah, thanks, Bob. Starting in gastroenterology, so we've canceled all elective endoscopies until at least late April. So currently we're only doing urgent endoscopies for outpatients and inpatients, and they're all being done by the attending on service at the Parnassus campus. And to decrease the number of people potentially exposed to the virus during an endoscopy and to preserve our PPE supply, GI fellows are not currently performing any endoscopies. This is obviously a huge part of our clinical training, but we think it's the right move at this time, given the need to conserve material as well as our human resources. And we've also changed our staffing to minimize the number of providers in the hospital at any one time to the smallest number possible, with fellows working from home available as backup. Like many divisions, our outpatient visits are almost exclusively being done as video or telephone visits now, and fellows have been participating in these as well. In terms of our educational programs, we've moved our regularly scheduled conferences to Zoom as well, and we're working on finding new opportunities for education that can be done remotely. These have included more frequent conferences than we might normally have, given the increased number of fellows who are working at home, as well as online learning modules on a variety of GI topics. Like many programs here, we're distributed across multiple UC sites, but I hope that one kind of silver lining that might come out of this is that by forcing us to use Zoom for education, it may open the door to having more of those site-specific conferences become program-wide after we all return to normal operations. I've also been talking to fellows and program directors in other medicine specialties over the past few days, and the changes we've made in GI generally align with what others have been doing. Many programs have also changed their staffing to minimize unnecessary exposures and allow for more extensive jeopardy coverage. For example, some consults are being handled by the fellow gathering the history by calling the patient's room with only the attending entering the room to actually perform the physical exam. Like us, pulmonary fellows are not participating in bronchoscopy. Most programs are also doing Zoom conferences, and some others have also added additional remote learning, like cardiology has been having their fellows read diagnostic studies like stress tests on their own, and then convening a video conference with the attending to discuss the findings together and learn. Fields that are more on the front lines of dealing with COVID, like pulmonary critical care and infectious diseases, obviously have most of their educational conferences dedicated to COVID-19. While this, for the early fellows, may have had a negative impact in terms of learning about other aspects of the field that they all need to learn about, certainly there are positives in terms of more learning about public health, health systems, and quality improvement. And I've also heard that some divisions are considering whether their soon-to-graduate senior fellows may need to be moved into clinical instructor roles early to serve as backup attendings.
Thanks, Colin. How long, if this goes on for X period of time, do you worry about not getting the skills that you need, particularly on the procedural side?
Yeah, I think that's something that we're going to have to think about if this goes on for months, especially if this goes on into July when we have new first-year fellows coming in as well. We'd have to start their procedural training.
Okay, thanks. Let's turn to the medical student perspective, and let's start with Hope first. And so Hope is a first-year medical student, and an interesting way to spend your first year. I'm sure you didn't bank on this one either. Tell us a little bit about how it's changed life as a medical student.
Yeah, thanks, Dr. Wachter. It's certainly been an interesting curveball in the middle of our first year. I'll talk a little bit about just how our curriculum has changed during the COVID pandemic, although Dr. Lucey alluded to a lot of that. And I also want to highlight some of the work that medical students are doing right now to support our frontline providers, and the way that collaborating with our administration has been super instrumental in terms of figuring out what our roles as preclinical medical students can be in this pandemic. So as Dr. Lucey mentioned, we have transitioned fully to remote learning for our preclinical didactic curriculum. And this has also unfortunately meant that our in-person clinical curriculum, we spend about 1 day a week in a hospital environment as first-year medical students, has gone remote, and parts of it have been postponed. For our preclinical curriculum, we are using a combination of live lectures over Zoom and both synchronous and asynchronous small groups and independent learning modules. And we've actually transitioned a number of elements of our curriculum to focus on the pandemic. So in our core inquiry curriculum, where we learn about research methods and conducting research, we've been learning about the epidemiology and the public health perspective on the COVID pandemic, as well as some of the ethical issues surrounding the treatment of COVID patients. And then in our clinical microsystems clerkship, which is normally in person in a hospital setting, we've been focused on gaining clinical knowledge about the disease itself, and then also building an understanding of how the health system has responded to the pandemic and what some of the challenges there have been. I would say overall, in terms of how our class has responded to this pandemic, it has been a jarring transition to be away from campus. I think many of us as first years, and Abdi will be able to speak to the experience of older students, but we really felt that we had been sort of hitting our stride in our curriculum and building our community. Something that's been super helpful during this time is definitely just the increased frequency of contact and communication, and open and transparent communication with our School of Medicine leadership, and a lot of really awesome efforts by our classmates and by people in the School of Medicine leadership to really make sure that we're continuing to build community and maintain community, especially given that we will be remote through June 2020. So a number of students have actually left San Francisco. So that's been an ongoing challenge for sure. The other thing I really want to highlight is the work of a group of students, which we've decided to call UCSF COVID Student Aid, which is sort of an umbrella organization that is currently housing all of our UCSF School of Medicine and now interprofessional volunteer efforts. So pretty early on, about 2 weeks ago, it became clear that a number of School of Medicine students from across all classes were starting to coalesce around different volunteer opportunities and different ideas for how we could support our frontline providers, even though we can't actually be in the hospital. And so we came together with School of Medicine leadership to form UCSF COVID Student Aid, and we've been able to connect students with volunteer opportunities, which have included providing childcare and other at-home support for our frontline providers, the PPE drive, which Dr. Wachter talked about, blood drives, 2 blood drives coming up this week and next week at our Parnassus and Mission Bay campuses, as well as a number of other projects, health literacy, community partnerships, and some other things that Abdi will be able to speak to as well. I think what this experience has made really clear for us is that medical students, preclinical and clinical med students are going to have really evolving roles in this pandemic, and that being able to build a strong collaboration and an organizational framework between our students and the School of Medicine has already helped and will continue to help to adapt to the changing needs of our healthcare system and to figure out where medical students can fit in as this pandemic evolves.
Great, thank you. I have to say you guys have been magnificent. Let's turn to Abdi, sort of take it from there. Different perspective. You're an experienced old hat at this, right? You've been doing it for a few years, but at a different stage of your training. So how is it feeling, and how have things changed for your class?
Yeah, similar to what Hope was talking about, there's definitely been a lot of changes that have been happening during this time. I think one difference between the preclinical and the clerkship experience is that the preclinical experience, even though, as Hope mentioned, it's definitely been a challenging transition, I think it lends itself a little more easily towards transitioning towards virtual education. But that's not the case as much for the clerkship experience. So for my classmates, I know that there's been a lot of anxiety and confusion about what will be happening and if we'll be able to have enough clinical exposure. And I think that the administration has responded to that confusion with transparency. There were town halls and Q&As essentially every day last week. We've also been inundated with emails that everyone has actually been reading. So I think that my classmates have really appreciated that, in terms of, we realize that the situation is evolving rapidly, but we've really been kept in the loop every time something has changed. And during the past 2 weeks, we've been encouraged to engage in independent studying to really try to shore up our medical knowledge. And then, similar to what Hope has mentioned, I've been really inspired by my classmates that have found a multitude of different ways to try to volunteer and contribute during this pandemic. My classmate India was on MSNBC the other day, really trying to advocate for PPE donations. So it's just been incredible seeing the work that everyone's doing, the way the UCSF COVID Student Aid Group has really been able to coordinate those efforts.
I might have missed it, Abdi. What rotation are you, or were you on right now?
Yeah, so I'm on my surgery rotation, which has been especially difficult because all the elective cases have been canceled. And I think that what that's going to look like moving forward is still in flux, because we won't be able to go in and actually engage in the clinical environment. So figuring out how we can still meet those competencies without having that exposure to patient care.
Right. Okay, let me remind people, if you have questions, go ahead and submit them through the Q&A box, and we should have 10 minutes or so for questions. So I basically have one more for all of you, and I'll give you a choice of which one you prefer to answer. One is if you have any advice for your peers at your stage in terms of what you've learned or your classmates have learned, sort of things that you've done for your education or to keep yourself healthy and sane, or put yourself into a space where you're thinking back on this 20 years from now. What will have been the most profound lessons you think you will have learned from this experience? It's probably too much to answer both of those, so pick whichever one you think is more interesting or you'd like to address. And maybe I'll start with Colin on that one.
Yeah, I guess maybe I'll start with the first one, just advice for kind of peers as well as leaders across the institution. I know our program leadership has been checking in with us regularly with email updates as well as Zoom meetings. Like Dr. Berman said, communication is really, really key, and I've been very impressed by how much everyone has cared about that. And that came up in all the talks I had across multiple specialties as well. It seems everyone is doing some form of check-in with their trainees, which I think is really important. This is a really stressful time to be a frontline provider, so it's vital that our leaders develop strategies to help us stay well. Certainly robust jeopardy systems are part of this, but we also need to ensure there's a culture that allows transition of care, not just if the frontline providers need to self-isolate for medical reasons, but also if fatigue or stress become too great. And I know I've been reading data from other countries that suggest that healthcare workers not only face greater risk of exposure to this virus, but also may have worse outcomes if infected. And it seems logical that the negative effects of stress and fatigue contribute to that. So we really strongly need to look out for the health and well-being of our trainees, not only those with medical conditions that may make them more at risk for COVID, but everyone in general. And certainly the national PPE shortage is obviously a great concern. And so I'm really appreciative of all the efforts that the medical students have been doing in terms of soliciting donations, because I think we're fortunate here to not have as severe a shortage as places like New York, which has been very scary to read about.
Yeah, great. Thank you. Katie, let's go to you and see either one of those that you'd prefer to answer.
Sounds good. I think I'll give number 2 a shot. And I think when I'm thinking back about this time in the future and reflecting on what it means to be a resident physician or a trainee during this time, I honestly think it's going to be really interesting to see what lessons I do take away. There's already a lot I've learned in terms of collaboration, communication, crowdsourcing, being adaptable and responsive to feedback. But I think really I'm feeling that big sense of mission, of sort of that feeling of why you went to medical school to be a doctor, and the sense that a lot of us have about how much it's a privilege to take care of our communities during this time and serve in this role. And I've been so inspired by the residents and colleagues that have expressed again and again their sense of purpose during this crisis. And I think at the same time, just as Catherine had mentioned, that there is this tension between our duty to provide care and also the feeling of personal infectious risk during an unprecedented time with shortages and healthcare worker risk. And I think in medical education, we talk a lot about the service learning balance for our trainees. And even prior to the pandemic, there was an ongoing dialogue, both at our program and programs across the country, about some of the working conditions that trainee physicians face. And I think that now, at a time when our students and resident and fellow level physicians are being called to serve, we're ready to use our skills. And I know we're going to do everything we can. And I think when the dust settles from all of this down the road and we have some time to process all of our experiences from our peers across the country and from our colleagues, I'm really hopeful that we can learn from each other and learn how to take care of each other and eventually resume that dialogue about our large medical trainee workforce. And for now, I'm really feeling that sense of this being our professional call, our mission to be here. And I think we're ready to adapt and be flexible and step up.
Great. Thank you. And I sort of note that Catherine and I were both at San Francisco General and UCSF when AIDS hit. And I think we have a similar feeling of looking back, certainly not fondly. It was an incredibly difficult time, but some life lessons and professional lessons that I think are remarkable and have stayed with us. Abdi, your turn.
Yeah, I'll try to tackle the second question. I think this is a pretty interesting time because there's an ongoing national conversation of what the role of medical students should look like during this crisis, whether we're just learners in the clinical environment who are there to observe, or if we're able to contribute to patient care in meaningful ways. And UCSF, in keeping with the tradition of being on the front lines of epidemics, such as the HIV epidemic, has made the decision that medical students are essential members of the team at this time. And like everything else, there's certainly a risk-benefit assessment that needs to be done, whether there's enough PPE materials so students can avoid unwittingly serving as vectors, or concerns about student safety. So I think that the administration has made the right choice in pulling students out of the clerkship environment temporarily and working with healthcare systems so that we can be reintegrated in a way that contributes to patient care instead of detracting from it. But I think one thing I just want to add to that conversation is that as medical students, we decided to pursue a career in medicine to be able to take care of those who are ill. And right now, our profession is really calling on every medical provider to do that. So I'm proud to be at an institution that has made that decision, but is also taking the necessary precautions to make sure that students are safe and contributing to patient care when we eventually reintegrate into the clinical environment.
Great. Thank you, Abdi. That's inspiring. Hope, let's turn to you last, and whichever one you want to tackle.
Sure, I can give a go at the first question that you asked. I think what's been really amazing to see during this time, and the advice that I would continue to give our leadership, is to just continue these collaborations that have already started, to think super creatively about how medical students can actually fit into this in a way that is in service of our patients and in service of other providers. I think there is a little bit of a tension always, as Abdi alluded to, as a trainee, between learning and service. And a lot of us are very focused on, I think, this feeling in our class right now that we don't have a lot of skills that are directly applicable that we can contribute here, and yet have an enormous amount of motivation. We chose this career, we chose this institution, and we really, truly do want to be contributing in any way we can. So I think it's already been wonderful to see our administration be really flexible, to work with us, to be really creative, and to come up with ideas that are actually useful. And I think talking about some of the medical student efforts would not be complete without talking about this national community of medical students that has really coalesced around this issue. I think there's been a ton of support shared, resources shared, best practices, people sharing experiences with one another, largely through social media, mostly Twitter, and also a couple of sort of medical student nationwide Slack channels that have been an incredible source of support. And so I think that, I hope this can be a model for ways that we can use these emerging forms of social media that are pretty present in all of our lives, to collaborate and interinstitutionally, not just among medical students, but at all levels of trainees. And then to speak a little bit to how I would give advice to my peers at this time. It's definitely challenging to feel like we're sitting on the sidelines, but I think I personally have tried to think about my role in this in two ways. And the first is that being a learner is our primary identity here at this stage in our training. And although it's not immediately contributing to the pandemic right now today, our learning is incredibly important, as Dean Lucey alluded to at the beginning of this, to be able to continue to have a robust healthcare workforce. And so really seeing learning as really important work and really worthwhile work has been important for me. And then the second thing I think that's important to think about is that any work that we can do that helps support our frontline providers and help support our patients here at UCSF is incredibly worthwhile. And so a lot of the work that we're doing through UCSF COVID Student Aid is not necessarily exactly the work we came to UCSF to train to do. But I think the feeling that we are furthering the mission of UCSF and we're a member of the team has been incredibly important and incredibly impactful. And I think our roles will continue to evolve, but we are going to continue to think about it in that framework in terms of, whatever we can do to further the mission of the team is worthwhile work for us to be doing right now, in addition to our work as learners.
Great, thank you so much. Let's switch to the Q&A section. We've got about 10 minutes for this before we sum up. So we can actually turn everybody's video on. That's the 4 trainees, as well as Rebecca, Pat, and Catherine. Let me start with Catherine. 4th-year students at many other schools are sheltering in place, meaning staying at home, while our students are still reporting to the hospital, at least some of them, including emergency departments and other services. The question was quite blunt: are we doing the right thing?
I believe we're doing the right thing. And I believe the decision that we made was made very thoughtfully in adherence to our principles and after consultation, not only with all the deans of the schools, of other schools of health professions at UCSF, but with all the UC deans across the system. And all the UC deans across the system agreed with the same principles: keep people advancing towards graduation, don't relax your requirements, make the students safe, and provide opportunities to ensure that students who are in the clinical environments are appropriately supervised with the right PPE. we believe that pandemics or epidemics and crises in healthcare are not unusual. You know, as we have talked, Bob and I were in the HIV epidemic together. We've had several other crises since that time. And we think that this is a core competency that our students should be prepared to master. And the best way to do that is to work safely under the guidance of outstanding UCSF physicians during a supervised training environment. I will say that across the country, whether or not the students are in or out has been an ongoing national debate. And there's a lot of circumstances that are locally relevant to that, the penetration of the virus in the community, availability of PPE and beyond. But we feel, as Abdi said, our students are essential. They can contribute in substantial ways to the care of non-COVID patients, in fact, perhaps even providing more support for those patients, and they're ready for the job. Those who can't, because of unusual personal circumstances or health conditions, have alternative strategies to advance their education. But the decision was made in a principled, evidence-based way after a lot of consultation, and we are quite confident that we have made the right decision for UCSF, as we are that other schools may have made a different decision that's right for their school.
Okay, I don't know if either of the students want to comment on that from your perspective. Does it feel like the right call? Abdi, you want to say a word?
Yeah, I feel like it's the right call. I know that a lot of my peers have tried to advocate for that and have shared with me that they would want to be in the clinical setting. But as Dean Lucey mentioned, I want to acknowledge that there are students who would probably prefer not to be back in the clinical environment for a variety of different reasons. And I'm hoping that administration would be willing to work with students based on special circumstances. And it sounds like that is what's happening already. Yeah.
Great. Catherine, this didn't come in, but I can't hesitate. I can't not ask. What are your reflections of the early days of HIV? You were actually chief resident at San Francisco General. And you were my resident, if I recall. So,
the retrospectoscope is rosier than it was at the time.
Yes.
I look back and I realize that it was a transformational time for me to develop as a physician. It taught me the value of a holistic response to epidemics that involved not just the care providers, but the basic scientists and public health people and patients who were affected themselves. And also the importance of community that Rebecca and Pat talks so eloquently about, and Katie supports in her role as chief residents. So I think looking back, it really shaped the way I approached my medical career going forward. At the time, it was frightening. We actually didn't know what caused HIV when it started. We didn't know how it was transmitted. And I think a little bit different at the start of the COVID environment, but maybe unfortunately not so much as it advances, is one of the unusual stressors was that the people were the same age as we were. People who were dying were the same age as we were. And that was something that no medical school that I attended, which was a great medical school, had prepared me for the emotional, moral distress, as people have talked about, of caring for people who were critically ill, often shunned by their family, and very similar in characteristic to the people who I was working with. So it was tough. But it was transformational.
Yeah.
And Bob, would you agree?
Completely. And I also note that I think it forged leaders in many ways. People were both forced to and had the opportunity to step up to the plate. And notice now the FDA commissioner was a trainee with us, and several other leaders that have emerged from that crucible. Rebecca, you've talked about a lot of innovations, and I think also kind of implied that we're working at lightning speed. The kinds of things that might have taken a year of committee meetings are being done in 2 days. Which ones do you think are going to stick when this is over, and which ones will go away?
I think my hope is that the spirit of collaboration lasts long after the pandemic resolves, of people across departments really talking and figuring out how we can work together. And the other thing I would say, you know, at UCSF, we have a unique challenge with 3 separate hospitals, and even in UC UC Health itself, we're separated across the city, this idea of using technology to really create community. I hope we continue with the virtual town halls, and I definitely want to continue with our annual virtual match toast, which I feel like are actually really nice ways to use technology to bring us all together.
Yeah, great. Hope there are several questions about the efforts the students are taking. One was, can first-year students outside of the Bay Area contribute to your efforts or be part of it? And the second, is there any way for UCSF staff to contribute to the work that you and your colleagues are doing?
Yeah, absolutely. That's a great question. We have a number of opportunities that would be appropriate for remote work. One that maybe Abdi can speak a little bit more to is an ongoing COVID health literacy project in collaboration with our peers at Harvard Medical School, where we are trying to translate and create community accessible materials about COVID to educate the community about, what they should do, what they should be looking out for. That's one example. Another thing I will say is that COVID student aid here at UCSF is an umbrella for a number of different projects that people are working on. And so every day we have people bringing us new ideas for projects. We have faculty coming to us asking for support with their research or their community engagement initiatives. And so really any idea that anyone on this call is interested in, we can help support and connect people to the right resources.
And how do they get to you? I know you guys have a Twitter handle because I see you there.
Yeah.
Do you have a website, or do people email you, or how do they get to you?
We don't have a website right now. We do have a Twitter handle. If you're on Twitter, you can follow that handle and send us a direct message, and you're also welcome to email me personally. And that goes for staff as well. We would love to figure out how to get staff involved in these efforts.
Great. And the Twitter handle is, do you remember?
The Twitter handle is, let me double check. I believe it's at UCSF COVID Student Aid, but I'll get back to you.
I think that's right. And for people that are Twitter fans, I have been tweeting my observations of what's happening both at UCSF and a little bit around the world every day, and it seems to be getting a fair amount of notice. So if anybody is interested in at least one person's view of it, I'm Bob_Wachter. Abdi, did you want to add anything about the opportunities for others to contribute?
There's also, for the students, there's an email that's sent out every week that kind of consolidates all the volunteer opportunities as well.
Great.
Yeah, and then if we have a quick moment, I did want to make one unrelated comment.
Go ahead.
Yeah, so I just wanted to reiterate that even though social distancing policies are in place, that doesn't mean social isolation. And one thing that we've been really trying to focus on is how to maintain that sense of community among students. Justin Bullock had a really amazing piece the other day that commented on some of the struggles with mental health in graduate medical education that I would really recommend to everyone. But just remembering there in this time that we should continue to take care of ourselves and each other as well. And a term that I've seen used is physical distancing instead of social distancing that I like a lot more.
Thank you. Thank you. Yeah, Justin's piece, Justin's an intern with us and was a medical student here and is extraordinary. And his piece is in this week's New England Journal, and it's amazing and really powerful. So recommend it to everyone. We only have a couple of minutes left. Let me give Catherine and Rebecca an opportunity to just sort of sum up or any observations or reflections on what you've heard. Catherine, do you want to start?
I would just say that every day I get up and I thank my lucky stars that I am at UCSF during this time. The students are extraordinary. The ones that you heard about today, they're extraordinary, but they're not unusual. We have another 650. Katie and Colin are just two exemplars of the talent that's in our GME program. And Pat and Rebecca are also tremendous leaders in medical education, supported by literally dozens of other Department of Medicine and School of Medicine faculty. So this is the right place to be at this time, not just because we have a great mayor who may have helped us bend the curve earlier than perhaps in New York City, but because these are the people that are going to solve this problem and come out as a stronger community. So thank you for this opportunity.
Thank you. And thank you for your leadership, which is always exceptional, but it's been tested and it's truly inspirational. Rebecca.
Thank you.
I would echo everything that Dean Lucey said just about how inspiring I am finding working with everyone here at UCSF. And I'm actually inspired by this talk today, as Hope and Abdi talked about the volunteerism being done by our medical students to show that everyone can help. You don't need to be a resident or a physician or a healthcare worker to be able to contribute. And I love that so many questions on the Q&A were, how do I get involved? How do I get involved? And so just pushing us all, this is a time when, as Abdi said, we can really improve our community and improve how we feel like we are united together while remaining at physical distance.
Fantastic. Well, let me end this session, but not end the entire Grand Rounds, which has another hour and a half, but end this session by thanking all 1, 2, 3, 4, 5, 6, 7, 8 of you for everything you're doing, for participating and helping to educate us on what it feels like to be a trainee and a leader in medical education at this time. I think, as I said many times, this is a stress test for an organization, and I've never been more impressed by the way all of you are responding and what the organization is doing to get through this and to lead. So thank you all for this. And just a reminder for people that are signing off, others are coming on for the research session. I'm hoping you'll stay for both, but this is going to be on YouTube later, and I hope you'll tell your friends and colleagues to view it if they're interested in the topic. So let's go ahead and sign off for that for the first group, and we'll